Hey y'all, Kayla Mowdy, Doctor of Physical Therapy here. Today, for Monday Educational Moment, I'm going to talk about stretching. So, I ran 2 5Ks this Saturday, and I observed that after everybody finished, some few people kind of walked it out a little bit and cooled down, but very few people stretched. So, I have a few stretches today. I'm just going to show you 4 basic leg, the basic big leg muscles to stretch out after you run. These are for people without injury or pain. If you are babying an injury or if you're hurting, please go see a PT in your area or come see me. We can give you more specific stretches, more advice based upon your injury. The reason that I recommend stretching after every run, even if you don't have an injury, is because if you are working these large muscles, they are carrying you a long distance, so it's good to give them a little bit of attention afterwards because they can become shortened from working them, and the lactic acid builds up in the muscle, and also they will shorten, and then you're prone to overuse injuries and some muscle imbalance problems as well. So the main thing I tell my patients or people this weekend that I was teaching how to stretch is go for moderate stretch only. A lot of people push everything all the way to end range. What that does is your muscle senses that it's being pulled at both ends, and it actually clamps down and says, no, don't do that. So if you're pushing these things through pain, you're not going to get effective stretches. So moderate stretch only, just that first pull, take a few deep breaths and relax into it. Here are the stretches that I would recommend. These are chair-based. There's a laying down version of this as well. So piriformis, you cross your leg in a figure 4 position, sit up real tall and bend over. You may not bend over as low as that girl goes, but when you feel the stretch in your butt, that is correct. And then next is hamstring. There's a way to do this sitting or laying or standing, but this is the sitting version. Kind of sit up real tall. I don't even like this much lumbar curve that this girl's got here. So actually sit up real tall, stick your chest out, and bend forward. And then this is quad, would be the third one. Grab. This is for people with good balance, but she's also holding a chair. Grab the chair, grab your ankle, push your hip forward. The knee should be straight down. So if you're having trouble getting the knee straight down, if it's too tight, there's a couple other versions of this. Reach out to me or come see me in the clinic if you're actually having hip flexor, quad, hip, pelvis, low back problems, because one of these two might be your culprit there. Both of those attached to the pelvis pretty strongly. And then calf or gastroc. So this girl is putting her foot up on a half foam roll, but what you can do is just grab a curb or a root or anything like that and put your foot on it. Each of these stretches, I recommend at least a 30-second hold. So that's a mistake that even people who do stretch make, is that they just do them for like 10 seconds and they move on to the next muscle. So to get an adequate lengthening of the muscle, you need a 30-second to even a minute. A lot of my patients, I stretch sometimes for a minute, and I just do one good stretch each leg, each muscle group. You want that long duration, low load stretch to get the maximum benefit per evidence-based research that we've done to find out what's the most effective way to stretch. So those are just 4. There's lots more. If don't use this video to treat yourself, this is just for basic wellness advice. If you have any questions, specifically reach out to me and start stretching after you run or after any exercises, anything with your legs. These are really great stretches to do. And have a good Monday. Bye.